Good day, students. It's my privilege to welcome you today to the Nelson Mandela University and the Student Health Services in particular. I'm Sister Dalton, one of the sisters working in the clinic. The aim of this talk is to provide you the who, the where, the when, the how, and the what of using our service. So why do we need clinics at the Nelson Mandela University? Staying healthy is one of the most important things that you can do when you are at the university. And our advice for you is to prevent illness and to seek treatment early should you become. Where? Where are the clinics situated? There is a clinic on 5 of the campuses, one at South Campus, and in the picture you can actually see Embazweni, and we are on the lower ground. North Campus, it is opposite Lebombo Residence. At 2nd Avenue, it's behind the auditorium, next to the cafeteria. At Missionvale Campus, it is at the entrance to the admin building. And on George Campus, it's near the library. Currently, only 3 campuses are active or in operation due to COVID. It is the South Campus Clinic, the North Campus Clinic, and the George Campus Clinic. Who renders this service? Registered nurses, counselors, medical secretaries, and we have sessional medical doctors that come to the clinic for an hour per week. Who may use this service? All registered Mandela students and all official visitors to the university may use our services. We are operational Monday to Friday from 7:30 till 4 by appointment, and no payment is required. How do you access the clinics? Bookings can be made online, or you can phone for an appointment. Online, you will find the link on the student portal page. Important to notice that if you are ill, you should make an appointment with a nurse. Should you require an HIV test or need health counseling, you're welcome to make an appointment with a counselor. What services are available? We treat all the primary healthcare related illnesses that might be like there. First aid, so treatment of any minor injuries, management of medical emergencies and referral to hospital or doctor. General health, your minor ailments such as colds and flus, tummy infections, monitoring of chronic diseases such as high blood pressure, high blood sugar. We do not provide chronic medication. We are LGBTQIA+ friendly. We provide reproductive health care in that we provide all the contraceptives that are available, injections, oral contraceptives, also the morning after pill, and the 3-year implant, and barrier methods like the female and the male condom, and we also do pregnancy testing. Abortions are legal in South Africa, but they may only be done at registered services, and the university is not one. Sexually transmitted infections. Provide treatment for all the sexually transmitted infections. HIV, as you know, there is no cure, and I will discuss that shortly. From our side, prevention of STIs is best, so abstinence is best. Use your condoms carefully, be faithful to one partner for life, screen your partner, and preferably have an HIV test before commencing any sexual relation. HIV, it is important to know your HIV status. and our challenge to you is to make sure that you have an HIV test, so that should you test negative, that you can do all the correct things to make sure that you maintain that status. Should you test positive, we can then start you on the positive regime of going onto ARVs and preventing yourself from getting serious illnesses. Part of our HIV prevention and treatment is that, and as a NIMART site, we provide HIV medication in 3 areas. Pre-exposure prophylaxis, so that is ARVs that are taken before you've been exposed to HIV. For instance, if one partner should be positive and the other partner is HIV negative, the HIV negative person can go on to PrEP to prevent themselves from getting HIV. PEP, or post-exposure prophylaxis, are ARVs that are taken after exposure. It should be taken within 72 hours, and important to note that it is a 28-day course, so you may not stop till you have finished the 28 days. And then, of course, we provide ARVs for somebody that is HIV positive. And the reasoning for that is to minimize the effect of HIV, to strengthen the immune system, to reduce the viral load, and increase the CD4. Substance and alcohol abuse. Use and abuse of alcohol by students is common and can have serious consequences. In the age group 15 to 24, 50% of deaths from accidents, homicides, suicides involve alcohol and drug abuse. Drug and alcohol abuse can also contribute to physical and sexual aggression, such as assault or rape. Dagga. Since 2018, it is legal to use Dagga at your home for private use in South Africa. The Nelson Mandela University policy still declares that it is illegal to possess or use Dagga on campus and in its residences. That includes the off-campus residences. Our message to you is prevent alcohol abuse or misuse, know your limits, Madibas don't abuse, eat before and while drinking alcohol, take limited amount of money with you, sip your drink slowly, if thirsty, drink water first. Count your drinks, no more than 3 units at any occasion. Don't drink faster than 1 unit per hour. Don't drink when you need to study or to drive. Do not use alcohol if using any medication or are pregnant. Do not go drinking. It should be part of the activity, part of the fun, not the main aim. Drink a cool drink between each drink. Plan how you're going to get home and always have a sober designated driver. Use alcohol responsibly. NMU has strict rules and regulations in place. I'm not going to discuss them, but important to know. You didn't know. They are there. Residences as well. Make sure that you are aware of what is allowed and what is not allowed. Gender-based violence, sexual assault, rape will be discussed in detail by Mrs. Leventhal. Therefore, I'm not going to go into depth in that. Should you need any information, it is under the sexual harassment link on the web page. Prevention strategies after condom break or sexual assault. We can assist at the clinic with that. So the morning after pill can be given to prevent pregnancy, STI prevention can be given, and HIV prevention, the 28-day ARV tablets can be given to prevent HIV. Over weekends, we would advise you to go to the Doran Ginza Hospital, where the Tutuzela Care Center is, should you need treatment. Last thing that I want to discuss is COVID. As I am sure by now that you are aware that we are working very hard at preventing students from becoming COVID positive. All the things are in place to prevent, so we advise on the physical distancing, hand sanitizing, hand washing, wearing of the masks, and screening. Screenings are available on the app, at the clinics, at the laboratories, at the gates, and everywhere that you go. And the reason is to try and identify somebody that might become ill and don't even know it yet. Face-to-face classes are limited. Mask to mask is advised should you be on campus. We are currently working on the immunization program that should be rolled out shortly to ensure that we also work towards providing community or herd immunity. We also provide care and support should somebody be in quarantine or need to go in quarantine, and should they go into isolation. Areas of concern is that outside classrooms, after being in a lecture for a while, when you get out, that is where things often go wrong. At the laboratories, especially if there is not supervision, in the residences, room parties, there are many areas where you can put yourself at risk. And in conclusion, Student Health Service provide health education. We provide care and support for minor ailments, for TB, for HIV, for family planning, for STIs. And you are most welcome to visit us should you need any assistance. All the best with your studies.